everyone, welcome to my YouTube channel. So we have done with oxygenation need and now we are ongoing with health assessment, and in this we are done with interview technique, observation technique, purpose of health assessment, process of health assessment, health history, physical examination, methods including inspection, palpation, percussion, auscultation and olfaction in our previous video, and preparation for examination, patient and unit is being completed. Now we are proceeding in today's lecture. We are doing with general assessment of each body system, documentation, health assessment and finding health assessment. So these all are the topics which I explained you in my first lecture. So do copy the notes and understand the video. And now let's start with general assessment of each body part. So do visit that part 1 for more better understanding. So we are proceeding with general assessment. So is the definition: general assessment is the systematic observation and evaluation of the patient's general state of health, appearance and behavior, beginning the moment the nurse first encounters the patient. Now what are the components of general assessment? It includes general appearance, like how is the body built, posture, is he thin, obese, muscular or weak, grooming and hygiene, facial expression, anoxious, depressed, in pain, level of consciousness, alert or drowsy, unconsciousness. So this we will see in general appearance. Purpose of general assessment. What is the purpose of general assessment? To obtain a baseline data about the patient overall health, so that we can obtain the baseline data about the patient overall health, to detect obvious sign of illness and distress, to detect ताकि जैसे कि if he is having jaundice, so by general assessment we can see that he is having pale body. So these are the general assessment, we can detect the obvious sign of the illness or distress. To plan further detailed systematic examination, to establish report and initiate nurse-patient relationship, to provide information for diagnosis and nursing care plan. So these are the purpose of general assessment. Now assessment of each body system include general survey. First purpose: provide an overall impression of the patient health. Components include appearance, age, sex, posture, hygiene, grooming. Vital signs include height, weight, BMI, level of consciousness and orientation, gait and mobility, speech and behavior. Then we see of skin, hair and nails inspection, color, moisture, texture, lesions, scars, rashes. Palpation includes temperature. We can palpation, I told you earlier also that we can see temperature, turgor, edema, tenderness. And in nails we can see shape, color, capillarity, different time, hair distribution, thickness, scalp condition. Head and face, we can see eyes, we can see inspect eyebrows, eyelids, conjunctiva, sclera. Pupil assessment we can do by pupil equal होनी चाहिए, round होनी चाहिए, reacting to light and accommodation. विजन शुड बी विजुअल एक्यूटी, स्नेल चार्ट से हम विजुअल एक्यूटी चेक कर लेंगे, एंड पेरिफेरल विजन कॉन्सेंट्रेशन टेस्ट है. ऑप्थेल्मोस्कोप, रेटिना, ऑप्टिक डिस्क एंड वेसल्स. Now for ears we will do inspection, palpation and hearing test. Inspection include external ear shape, size, discharge. Palpation में tenderness. Hearing test में we can do whisper test, Renan test and Weber test. And nose and sinuses we can do inspection, palpation and smell, olfactory test. So inspection में symmetry देखते हैं. We can see the type of discharge, sputum deviation we can see. Palpation में sinus, tenderness, frontal and maxillary. Mouth and throat inspection, oral. We can see inspection से we can see lips, teeth, gums, tongue, palate, tonsils, pharynx and oral. Mucosa we can see for moisture, lesions, ulcers, speech and swelling. So head to toe assessment mainly includes of head, face, eyes, nose, mouth. but you एग्जाम से mainly abdomen का पूछ लिया जाता है, lungs का पूछ लिया जाता है. So upper extremity, lower extremity. So you can see these all things, and if you make while writing or explaining the general assessment, if you make the diagram, you are having more chances to gain marks. Respiratory system में हम inspection, palpation, percussion, auscultation we used to do. In inspection we see chest shape, barrel, pigeon, funnel. Symmetry we used to see respiratory rate हम देखते हैं, pattern, use of his stream muscles in breathing we see. Palpation में chest expansion, tactile firmities we see. Percussion में we see resonance, dullness, hyperresonance. And auscultation में we see breath sound, added sounds, Cardiovascular system inspection, we see pericardial movement, GVP, palpation, and we see apical pulse, fifth ICS, and thrills, hevels, auscultation, we hear S1, S2, murmur and gallop sound. Peripheral should we see pulses, edema, capillary refill, skin color, temperature. Then comes our gastrointestinal system, that includes inspection, we see shape, scar, distension, visible peristalsis, auscultation, we see bowel sound before palpation and percussion, and in percussion we see tympani dullness, we can percuss liver and spleen, palpation, light, टेंडरनेस, मसल टोन एंड डीप में ऑर्गन साइज मेजर करते हैं गैस्ट्रोइंटेस्टाइनल सिस्टम में. सो अगर एग्जाम में पूछ लिया जाता है कि राइट द जनरल असेसमेंट ऑफ गैस्ट्रोइंटेस्टाइनल सिस्टम, सो वी हैव टू फर्स्ट राइट अबाउट गैस्ट्रोइंटेस्टाइनल सिस्टम, देन वी हैव टू रीड आई इंस्पेक्शन, ऑस्कल्टेशन, परकशन, पाल्पेशन. और उसमें हम लोग करते क्या क्या है इंस्पेक्शन में, तो मेनली हम लोग देखते हैं तो उसका हम क्या देखेंगे, शेप देख सकते हैं, डिस्टेंशन देख सकते हैं. ऑस्कल्टेशन में सुनते हैं तो हम बबल साउंड, और गैस्ट्रोइंटेस्टाइनल में यही है, पहले हम इंस्पेक्शन करते हैं, फिर ऑस्कल्टेशन करते हैं, फिर परकशन था, पाल्पेशन लोग लास्ट में करते हैं. नो जेनिटो यूरियल सिस्टम में फॉर मेल वी सी पेनिस, स्क्रॉटम, टेस्टिस, हार्निया, प्रोस्टेट एग्जाम वी यूज टू डू. फीमेल में एक्सटर्नल जेनेटिया, वाइजिना एग्जाम, सर्वाइकल एग्जाम. यूरिनरी में ब्लैडर, पाल्पेशन, वी कैन डू यूरिन कलर, वी कैन चेक ऑर्डर, आउटपुट. And then kidney assessment, costovertebral angle, tenderness. Then we have musculoskeletal system inspection, posture, we can see alignment, deformity, swelling. Palpation में we can palpate muscle tone, tenderness, joint swelling. We can check range of motion, active and passive movement, strength, muscle power grade कर सकते हैं हम लोग 0 से 5 के बीच में. Gait, balance we can see, and coordination. Nervous system में we see mental orientation, memory, mood through process. सर्वाइकल नर्व्स 1 से 12 तक टेस्टिंग कर सकते हैं. मोटर सिस्टम, स्ट्रेंथ, टोन, कोऑर्डिनेशन. नाउ लास्ट टॉपिक ऑफ द health assessment and the final topic is documentation. After documentation, the health assessment is the systematic recording of the subjective and objective data collected during the patient examination. It provides a permanent record of the patient health status, care given and future plans. What is the purpose of documentation? Why we used to do documentation? To provide legal record of patient condition, to communicate findings among the healthcare member, to ensure continuity of care, to help in planning nursing care, to act as a evidence in case of medical legal cases, to serve as teaching and research. So this we are complete with our topic health assessment with part 1 and part 2. Hope you like the video, and if you found it useful, do like, share and subscribe, and do write and go through the notes. Thank you.